Developed a new test for one of the most common sexually transmitted infections that's often the cause of cervical cancer. Kate Nectarline spoke today with a gynecologist at UVA about how these self-serve HPV tests work and why they're so needed. She's live in our newsroom with a look at the swabs. Hi, Kate.
Hi, Steve. 8 in 10 sexually active adults will get an HPV infection in their lifetime. Now, doctors are leading the charge to shift the screening process from the exam room to the home.
This would allow us to screen more people for cervical cancer and hopefully get them the help that they need.
Dr. Carrie Zapata is a gynecologist at UVA Health. She says 95% of cervical cancers in women are caused by HPV. Up until recently, the only way to detect it was through a pap smear.
There's lots of people who find that exam very uncomfortable, so lots of thought has gone into how else can we do this exam.
That's where the self-serve swab comes in. Eventually, the hope is women will be able to do the test at home, but for now, patients can only use these tests at a doctor's office.
Inserting a swab into the vagina, meaning the patient does it themselves and collects vaginal, sometimes cervical cells, and then those cells are tested for the presence of the HPV virus.
If the test comes back positive, Zapata says patients must then go back in for a follow-up exam.
I think this is very significant for women's health. There's a lot of people that we're not screening for cervical cancer because they can't get to the doctor or they find the idea of having a speculum exam intimidating or painful.
Zapata says there is currently no universal screening test to detect HPV in men. Live in the newsroom, Kate Nectarline, 29 News at 5.